everyone. This is Mariah Taylor with Becker's Healthcare. Thank you all for joining us for today's webinar, Agentic AI, the breakthroughs hospitals and health plans can't afford to overlook. Before we begin, I'm going to walk you through a few quick housekeeping instructions. We will begin today's webinar with a presentation where we will have a Q&A session at the end. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access that recording. There are going to be 2 poll questions during today's webinar. All of those will appear on your screen when we're ready for you to give us an answer. So thank you in advance for participating. And if at any time you're having issues with the audio or visuals, try refreshing your browser. But if that doesn't work or you have other technical questions, put those into the Q&A box. We're here to help. With that, I'm pleased to welcome today's speakers. First, we have Raleigh Murch, Managing Director of Data and AI at NTT DATA. And then we have Kenny Cole, System Vice President of Clinical Improvement at Oschner Health System. And last but certainly not least is Heather Haugen, Vice President and Head of Healthcare and Life Sciences Consulting Practice at NTT DATA. Thank you, Raleigh, Dr. Cole, and Dr. Haugen for being here today. I'm going to turn the floor over to you, Raleigh, to get us started.
Yes, thanks so much for having me, Mariah. Hello, everyone. It looks like we've got quite a roster here today. Good full room, so definitely happy to be here. Certainly a pleasure to use this platform as distinguished as Becker's to hopefully inspire and educate on a very relevant topic today, one that's near and dear to my heart from where I sit, Agentic AI in healthcare. And as Mariah mentioned, I'm Raleigh Murch. I'm going to be your moderator for today's discussion. I'm the Managing Director at NTT DATA. So think about me, I sort of sit at the intersection between our customers talking about their business objectives and trying to understand where sort of facets of AI might meet that. So I jokingly refer to myself as a bit of a solutions Rolodex. And I know I've been in discussions probably for the last 6 months where Agentic AI is starting to come up. Customers are trying to demystify what it is, what it means, and how to apply it to their business. But before we get into that, wanted to address our Hollywood Squares who are with us today. I'm joined by 2 very important people, titans of industry, worlds of experience, masters of their respective crafts, Dr. Heather Haugen, Dr. Kenny Cole. Thanks to you both for joining me today. I thought maybe we could provide, maybe start off this segment here with the audience just to provide a little context, provide an intro from you both. So Heather, would you like to start?
Yeah, absolutely. Thanks, Raleigh. Heather Haugen, I lead our healthcare consulting business, and the work that we do with clients is oftentimes just thinking, as you said, about agentic AI in their environment. What are they doing today? What are some of their thoughts about the value? How are they doing their work? And then sometimes what some of their concerns are across their organization. So we recently had our client advisory board together and heard a lot of great feedback and input from our clients. And so, bringing that here today to talk a little bit about how we're seeing agentic AI in healthcare.
Thanks, Heather. Dr. Cole?
Yeah, thanks. Thanks for having me. Kenny Cole, first and foremost, I'm an internist, a primary care physician at heart. I still see patients. But I've developed over the course of the last decade or so, I've developed some degree of expertise in designing and developing new models of care. So I led the development of our Oschner 65 plus clinics, which are full risk Medicare Advantage clinics, a completely redesigned model of primary care, a team-based model of primary care with a new business model. And then I also lead all of our digital medicine programs, which is our attempt to digitize chronic conditions management and turn the management of chronic conditions into a longitudinal, continuous, connected relationship rather than something that's managed through finite, discrete encounters. Thank you for having me.
Thanks for being here, Dr. Cole. So as we said, our topic today is around agentic AI, right? So we're seeing this term everywhere. You're thinking about it's in journals, it's at work, all over social media. So many people I think are talking about the term, but no one's really taken the time to explain it. And so part of the hope to front end this session today was really baseline on, sort of what it is, so that everyone walks away with that kind of 100, 200 level understanding of what it means, and sort of maybe how to start to apply that, based on your maturity. So I thought we'd maybe, if we could move to the next slide. I think we've got some interesting data that I wanted to share just from an analyst perspective. And this is why I think we should really be paying attention. I mean, if you look at the slide, I mean, analysts are all over this. I mean, you're seeing phrases like, the top strategic trend right now. It's no secret because we're hearing it everywhere. And almost sort of half of organizations will be deploying agents by 2026, which is just crazy if you think about the impact there. And then a third of enterprise software providers are incorporating agents. So, I think that's pretty profound that everybody's about to be in the game here. And so it's really important that we sort of ground everyone what this means. And I'd be interested to sort of dig into everyone's perspectives here shortly. And so, as we could go to the next slide, I want to talk a little bit about the difference, right? The difference at the ground level. If you think about, generative AI, agentic AI, often the two terms get conflated. And they're really, if AI is involved in any facet right now, it seems like they want to call it agentic AI. But I want to make sure the distinction is clear. If you think about what generative AI is, that's really the technology, right? That's the technology that got us all here. And so, you might ask, well, what is the technology? And that's really the ability to create, new content based on natural language inputs from training data. So as we all know from our experiences, you ask about something and it will provide, it sort of semantically understands that and provides context or responses back to you, based on that ask. It doesn't take action. It doesn't perform other activities, but rather just sort of a request response. Whereas agentic AI is really more of kind of, I'd say it's the most advanced design pattern, the advanced concept utilizing generative AI. So that's really where we've put generative AI to work in enterprise. So I put together another small slide, if we could move to the next one, to sort of talk about the life cycle of kind of how we got here. And I think it helps to sort of understand the building blocks, to understand why, how we got here. So if you indulge me in this kind of slide, I know hopefully the based on the interface here, you can kind of zoom in and see where we're at. But if you think about this as a bit of a cartoon, and we start up in the upper left hand with static response generation, really that was, when this was launched, I think it was November 2022, we all heard about ChatGPT. It was raised to 1 million users overnight. It was pretty profound. It was a nice kind of interface to enable you to chat with technology. And it was this sort of all-knowing encyclopedia, right? You could ask any questions and you would just get a response. And it was a pretty, profound experience at the time. And that's kind of where this all really started, is the ability to communicate with a kind of a static response model. And we also later learned that, there's a training cutoff data, right? They just sort of opened the hood, they stacked in a bunch of data, they closed it, they shipped it, and now you can have a conversation with it. And that was useful for what it was, right? And so as we move up the maturity meter just a bit, and it takes us over to the square in the upper right, we've come to hear a little bit about retrieval augmented generation as a technique, or you'll often hear about it as RAG in certain circles. So RAG was the next evolution of the technology. This enabled us to say, well, that's great. I have this kind of frozen in time encyclopedia that I can talk about. But what if I have data that's corporate data, fresh data, other relevant data that I want to create that same experience with? How can I sort of make that happen? And so the retrieval augmented generation pattern was designed such as to not require a retraining of that model, but to enable us to add documents as a supplement to the discussion. So now you can not only ask a question, but you could ask a question and then pair it with a document, and you sort of get some of that natural language generative AI magic that included your documents. And that was pretty cool. So then sort of, hey, what next? It's great. We can have a discussion. We can have a discussion with our data, but we can't really do anything, right? So this would be pretty powerful if we could actually get the model to take action, or the technology to take action on our behalf. And so that's where we got into kind of the tools pattern. So if you follow in the lower left-hand corner, we have tool-assisted generation. And so that was the addition of tools to this concept. Now, when we say tools, we just mean, the sort of the availability to access additional external APIs. And so now the technology can reference and make calls to APIs when it's relevant to the state of the discussion. You might imagine a scenario maybe in a call center experience where you're talking to a bot, right? Talking to a bot, and it's a very, encyclopedia-based or knowledge-based driven discussion, which is great. But what happens if you've got let's say a customer that might be disgruntled or they're not getting the information that they need? How could you escape that conversation and reference an API that might do let's say an IVR transfer? And connect you to an agent, right? So that became a really powerful, additional tool or additional feature, kind of added on to the capability. And so that gets us to the here and now, which is the agentic AI, right? So this is the term, the concept, the design pattern that everybody's really excited about right now, and this is the ability to sort of use everything that I just talked about at your disposal. You've got APIs, you've got data, you've got the ability to do sort of cognitive learning all in one component. But what's interesting is it's not just executing executing paths in a consistent fashion. It's driven by sort of a metric, right? So it may have a directive that you give it. And based on trying to accomplish that directive, it's going to leverage anything that's available to it in any order to accomplish that directive. It can adapt, it takes feedback, and can create some really unique scenarios. And so you can start to imagine, when you start to encapsulating these capabilities within your enterprise, a single agent, multiple agents talking to each other, it gets pretty crazy. So that's why I'm so excited about it. That's why I'm just really excited about the technology and love to have this discussion. So I thought maybe with that sort of grounding, I thought we could maybe pause for a quick poll just to calibrate the audience. So as we sit here with a reasonable understanding of agentic AI, I hope, what are your plans for implementing agentic AI in 2025? Would you say A, already have agentic AI solutions deployed? B, building an agentic AI solution now? C, building a proof of concept for an agentic AI solution now? D, focused on implementing the building blocks first? And E, aspire to pursue at least one proof of concept for agentic AI in 2025. I'll allow the audience some time for some thoughts and just to lock it in there. See, we're about 21% there. Maybe just give it a bit here. I'd like to really see where we're at here. Excited to see how this is going to come up. I've got some theories, so I'm going to test and see how this turns out.
I'm trying to figure out if Dr. Cole and I are allowed to vote. Dr. Cole, where are you on this scale?
Well, we are in the process of deploying agentic AI solutions.
That's awesome. We're almost to 50%, Raleigh. We're working it.
Yeah. Can we get to 50 before we reveal? Folks, anyone? Oh. Maybe it looks like the activity has subsided. What do you think, gang? What do we have? Interesting. So looks like the center of gravity is sort of as expected. Yep. So we've got 40% plan to aspire to pursue at least one proof of concept for agentic AI. Let me see, and then focus on implementing. Yeah, so it's sort of interesting between already have agentic AI solutions deployed and building an agentic AI solution. Now, Heather, what's your reaction?
Yeah, as I think about this, it's not surprising at all to me that we have about 40% in that plan and aspire, just because we'll talk about this a little bit probably as far as life sciences plan and provider, but I'm seeing life sciences probably making the biggest moves around investment and value. And then we know that our provider organizations interested, understand the value, but probably are also just a little bit fatigued over the amount of implementations and the resource constraints. And so they're just being a little more planful, I think, and taking some careful steps.
Yeah. I think just inherently in the technology, there's just a little trepidation because this is one of the, breakthrough technologies that's happened in my lifetime as I've been following this, where there's some mystique about it. There's some there's kind of a black box element of it, which I think creates a little bit of, just pause because it's unclear to some what's sort of happening, in the box. Dr. Cole, any surprises here? Sorry, Heather?
I was just going to say, we are seeing our clients ask us, these questions about, what do you mean by autonomous? What do you mean by, the data that's being used? So we are getting good questions, I think, that are driving the awareness of what agentic AI is.
Yeah. I think we're spending a lot of time educating on the front end too. I know I'm spending a lot of my time just creating that sense of feel good and education on the front. I think is very important for adoption and utilization because when you understand the art of the possible, you sort of understand the technical concepts. You could just see this is just incredibly powerful. Okay, so I know maybe as we leave this, I know our audience is excited for sure to hear from our experts. I know I certainly am as we move into this, and so maybe we can get into some kind of thoughts that I had, questions maybe to get us engaged here. I think we can all agree that we're still in the early days with AI agents, right? And especially in healthcare. Potential is definitely huge for an industry that's overloaded with data and administrative burdens, I think for sure. And so, Kenny, this one's coming at you. Can you talk about some of the challenges you have as a healthcare leader and where you see agentic AI fitting into your overall strategy?
Sure. Yeah. I mean, if I have any bias to disclose, it's that I am biased towards primary care because I'm a primary care physician, and I can tell you in the 15 years that I was running my own practice, there was never a day, not a single day, where I left work and all the work was done. It was simply, what could wait until the next day, and studies bear that out. There have been studies that are 20 years old that would do an analysis of how many hours per day it would take a primary care physician managing a panel of 2,500 patients to manage all of the chronic conditions for that panel. That was estimated to be over 10 hours a day. How many hours it would take to do all of the preventive health counseling. That was going to take 7 hours a day. And then, there was a study published 3 years ago now in the Journal of General Internal Medicine that actually quantified everything. Like, okay, let's see the sick patients, all the guideline recommended care, the chronic conditions, everything that's on the plate of primary care. And that one came back at 27 hours per day. And so, the first use cases are really going to be about, how do we reduce the burden that has resulted in the burnout of so many primary care physicians and many medical students not wanting to do primary care because it's just so miserable. And so I think the initial use cases sort of focus on things like chart review, really trying to sort of summarize and distill that information to prevent, the number of hours that it takes to have to do that. I still actually, see patients. And so I have this elaborate pre-charting process that I do before I ever see patients. And that generally takes me about 2 hours. And so I can't imagine if I were doing that every single day, 2 hours at the end of the day on the next day's patients. I'd clearly burn out. And so anything that can help us to distill information. So within that domain of information synthesis is going to be very useful. Searching for information in the electronic health record is incredibly cumbersome. Electronic health records are good at processing transactions. And that's about it. And everything else is really about providing coding and documentation support for the billing transactions. It's not about organizing information to optimize the user experience and generate the best possible outcome for patients. That happens through superhuman efforts. I think one of the most encouraging areas that's going to happen, because like when I went into internal medicine, I loved thinking through complex clinical scenarios. I love those complex patients that, I would be able to sort of cerebrate on and like think about like, okay, what could this be? And go through a complex differential diagnosis. That was really fun during residency when there was like time to do that sort of thing in a learning environment. Once you get into private practice, the joy of that gets robbed because you have a 15-minute slot to be able to try to think through a complex differential diagnosis, and it's simply not possible. And so unfortunately, what ends up happening is you end up sort of into a referral engine. You're referring chest pain to cardiology and knee pain to rheumatology or orthopedics, and you lose the joy of being able to cognitively assemble all of that. And so the idea that Agentic AI could be a companion helping you to sort of be more efficient in thinking through a complex differential diagnosis. I think there are lots of other areas. I think, unfortunately, what's happened in medicine is, the volume of medical knowledge used to double about every 50 years by the year 1950. But by the year 2020, it doubles every 73 days. It's literally impossible for even the best and brightest of physicians to stay up to date with all of the latest advances in medicine. And so, even things now, like part of what I'm doing when I'm pre-charting is if I have a patient with chronic kidney disease, I'm going and I'm looking to make sure, have they had, look for protein in the urine. And if they have protein in the urine, are they on the right drugs? But those are all things I have to do beforehand because there's just no time to do it during the context of a limited 15-minute visit. And so the idea that an agentic AI could sort of be teeing some of that up for me and helping me to manage a panel by ensuring that patients are on the latest, medications that are indicated that we have the data for, but there's just a knowledge gap in terms of being able to incorporate it, being able to incorporate the latest guidelines and most recent evidence, into the delivery of clinical care. Is really just what I look forward to is the day that I can have that companion that helps me to be the best possible doctor that I can be, to restore the joy of practice for me, that can even educate patients too. Because I can tell you another thing is like a lot of the patient education material, like I rarely use it. And the reason I rarely use it is because I almost feel like it's been written by attorneys, or at least it's been written with a view towards the medical legal risk of the education, because it's going to warn people about all the bad things that could possibly happen. And then that just creates extra burden on a physician because we have to sort of sort through that and say, look, it says this, but that's really, really extremely rare. And you sort of have to parse through it. And so I've already turned to the generative AI to help me, generate patient education that's much more compatible with their health literacy, that's culturally appropriate. So I've already started to use that. So I just look forward to it restoring the joy of practice for me. And I've sort of sworn that the day that happens is the day I'll go back into full-time practice, because I love seeing patients more than anything else. It's not possible to do it well in the current system as currently configured.
It's clear you have a mastery in the implementation of the tech, and it almost seems like it's time for a new chair in the C-suite from a chief AI officer perspective, as someone that can wake up every day and think about the business and think about AI as an ingredient to add to the various recipes in an organization to really to make improvement across the board, because it's such a lift when you think about in-depth understanding of the business and thinking about all of the art of the possible and capabilities, and how do you apply those together. And I think it's very important to to ensure organizations start adopting those to alleviate many of the pain points that you discussed, because people don't have the time, as you just said. So I think maybe on the other hand, Heather, based on your conversations with clients, because I know you're meeting with, you're at that intersection similar to I am daily. Are you getting a sense that agentic AI is taking off sort of in your circles? And can you talk about other areas where agents can enhance administrative workflows, both for providers and health plans?
Yeah, I think some of the things that Dr. Cole talked about are going to resonate a lot in the examples that I give, because this cognitive load, especially for clinicians and folks on the provider side, I think there's just a lot of opportunity there around agentic AI. The other is we're definitely seeing a different cadence for provider, life sciences, and health plan. I'll try and give some examples in all of those areas, just a little bit to give us a flavor of what we're seeing. But it's focused on some of the areas that Dr. Cole was speaking to, which is, can I get the assistance I need? Not just, here's the piece of paper, but enough information from a chart that when I walk into the room, I don't have to spend an hour before, but I'm more informed as a clinician. So the autonomous piece of this, I think, is getting people's attention. That's very interesting. I also think it causes just as much of the kind of like, ooh, I'm a little concerned, autonomous, right? So we need that. And at the same time, I think that all of us that work in healthcare understand that there has to be some oversight. And so we oftentimes are talking to clients about that. And then the next thing that we're hearing is the more you can apply this to what we already have in place, the better. We already have our Epic, Cerner, Meditech, EHR. We already have an imaging system. We've got these other specialty systems. So the more you can do to increase our adoption of the use of our current systems, we're much closer to being able to have a great conversation about those, because we're still working on adopting some of those tools and workflows and processes and making sure they serve the organization. A couple of examples. Prior authorizations, whether you're a provider or a health plan, incredibly complex, incredibly time consuming. Can we do things like bring together patient eligibility, coverage? Can I submit a request and ask some information? Do I have clinical data and demographic data that we can bring together? Much more interesting to think about both plan and provider, that workflow with the assistants and the agents that Dr. Cole was speaking about, and Raleigh, you talked about earlier. More autonomous, more interesting, more helpful. But most people are also comfortable that prior authorization is in a space where they're like, okay, not as concerned that something is going to go off the rails, or we're going to have a compliance issue, or a decision that's made for a patient that isn't the right decision. In the life sciences realm, clinical trial recruitment, pretty interesting. An area where we know we can make a bigger difference in research when we have more of the right patients included in some of our trials, right? So whether it's recruitment processes, reviewing of EHR data, analyzing that patient data, do we have the right inclusion and exclusion criteria? Can we do a better job at identifying candidates across the globe, not just in the US, for example, that are eligible? Can we run clinical trials in different ways that make for a more compelling population, that mean more when the results are published because they come from a more diverse population? Even communication with potential candidates for research trials, just helping them understand what we're looking for, helping them understand what the commitment would be, the benefits to the overall population. So that time savings, definitely there's some probably cost savings. There's a question today too of could we introduce less bias in that recruitment process if we did it in this way? That you can probably ask that question in both directions. And Raleigh, at some point, I'm interested in your perspective. Is we could probably reinforce the bias, by using data with that bias, or could we overcome some of the bias that's introduced in those processes by using agentic AI? I'm optimistic, so I think we've got to find ways to overcome some of the bias that's there. Another in life sciences that we've seen a fair amount, and actually we're doing some of this work, is helping with those systematic reviews. So as you know, all of the literature and evidence in a specific area, can we publish that to have sort of a more compelling research, peer-reviewed example of what we know in an area of study, and identifying all of those papers, finding all of the ones with the right methodology, and analyzing and publishing that work makes a big difference even in how we develop clinical guidelines or how we modify clinical guidelines. And it's just incredibly labor intense. I was a PhD, I have PhDs. Systematic reviews are painful. Can we use some of our tools to make really good decisions about how we publish and the data that we have available to us in those areas? So those are some of the examples. There's many more. Those are a few that we've talked to clients about where we have some work that's possibly, starting to go on, and we're using agentic AI. But I think more than anything, we often start with, what is this doing to give time back for patient care? And that has been a bit of my mantra, and I heard resonate in the comments that have been made so far, is how do we give time back for thinking, for humans to think about and really make the patient experience and the clinician experience a better one, and one that's more focused on that outcome that we're looking for.
You said something earlier, Heather, that I wanted to bring back up to the top of the stack, which is, organizations that are sort of struggling on where to get started, and it often uses sort of incumbent platforms as a foothold, right? So it's like reviewing the AI roadmap for the EHRs, for other data platforms, for some of the hyperscalers, and that gives you an opportunity to experiment near where the data already exists, right? Near where there's already implementations, versus stand up some bespoke new technology over in some corner of the organization and try to figure out how you're going to maintain and support it. So I think that's an interesting, kind of nugget of information. I think that's worthy of repeating. I do want to remind the group, please definitely submit the questions using the interface if you haven't already. We want to make sure to have the type of conversation that you are looking for, that you find valuable. So please do consider using the interface and putting in any questions that you think are valuable as we continue forth, and we'll try to address as many as we can towards the end of the session. So Kenny, right back at you. So you're sort of at the top of the hill from a vantage point from Oschner's Health perspective, right? As you think about what they're doing for generative AI, particularly agentic AI, are you seeing results yet? Are you, I know you all are sort of toeing the water, as you mentioned. What are you seeing?
Well, I think it's probably a little too early to see results, measurable results. I mean, I think what we are seeing is a lot of promise. I mean, certainly from generative AI, yes, we're seeing results. Actually, we're seeing results in terms of like ambient listening. We've had physicians who basically have come to us and said, if you take this ambient listening tool away from me, I'm leaving, like just because it's made their life so much better. And so we're clearly seeing that, where we're early on in the deployment of agentic AI solutions. And the first area that we're going to be targeting there is patient education. We're also piloting things like charts summary, and so really within that information synthesis domain, and patient messaging. So we have done some work in sort of automatic messaging, but a lot of those have really been built on sort of optimizing efficiency, and where we see this going is not just in optimizing efficiency, but ultimately in optimizing effectiveness, right? And so from that perspective, we see this as table stakes. If you look at the way health systems have been constructed, they're really configured around the concept of economies of scale, like so many businesses, right? Like it's sort of mass production. Once you cover your fixed cost, the entire focus of your mass production of whatever product you're delivering is to sell as many services as you possibly can, because everything above and beyond your fixed cost is your margin. Now, what's happened in healthcare is the pricing that Medicare provides and Medicaid provides has not been enough, to offset to cover the fixed costs for health systems, all the bricks and mortar and the expensive things. And so what happens is there's sort of this thing where you're going to the commercial payers and you're trying to get higher rates in order to sort of cross subsidize the losses that you take on the Medicare and the Medicaid side of the business. We believe that world is turning upside down, and that essentially what's happening now is health systems are losing so much money on Medicare, Medicaid, that they can't, and they can't drive up the rates high enough to kind of cross subsidize. And so they're eking out these little tiny thin margins, and the volume of money that's being lost when Medicare patients are bouncing around to specialists and ending up in the emergency room, ending up in the hospital. We believe the entire focus needs to shift towards keeping those people out of the hospital, out of the emergency room, reducing the need for specialty care. And the only way that's going to happen is if we can fortify primary care enough to be able to assist them in managing these patients, so that we need fewer specialty consults and they end up in the emergency room less. And so really just trying to invert the whole model and looking at this, through the lens of sort of ecosystem transformation, understanding that care delivery is this complex interplay of people, processes, technologies, and that every new technology is going to have a ripple effect across the ecosystem. And I think everybody felt that sort of an electronic medical record was going to be the thing that was going to transform healthcare and make it more efficient and effective. All it did was bring us out of the Stone Ages. And like most new technologies, what we did was we just kept the same processes, same workflows, but just kind of tried to embed it into the technology. And that's not going to work. And I wish I could think of some of the earlier examples right now about how this has happened in the past, but it's emblematic, right, of how people think about new technology is they don't see its full potential until later on. And so we're trying to look down the road at what the full potential is to completely reinvent our business model, our care delivery model, and give us an entirely new set of capabilities that is going to allow us to accomplish sort of the quadruple aim of healthcare, the quintuple aim of healthcare. Yeah. And we need to have strong governance in place to be able to make sure all of that gets deployed, properly prioritized, adopted, scaled, monitored, and so forth.
Yeah. Thank you for that, Kenny. It's interesting. I think people, because of the AI zeitgeist that's happening right now, unlike many that have seen in the past from a technological innovation perspective, we're still early days, right? I mean, we just started talking about agents, maybe 6 months ago, and we didn't get generative AI until end of 2022. And so it's really, even in my experience, it's rare to see strong demonstrated production scale AI, generative AI solutions that are just out there pumping and performing from that perspective. And I end up having sort of set a lot of expectations relative to that. And so we're moving as fast as we can, as carefully as we can from a technological perspective. So Heather, I'd be interested kind of in your perspective on this area as you think about, the NTT DATA clients that you work with. Are you seeing similar considerations as Dr. Cole mentioned? Are you seeing traction? Are people making inroads from your perspective?
Yeah, I think we have learned some things from some of our other implementations across healthcare, and especially in provider, in these kind of EHR revenue cycle implementations, that really an implementation is not nearly enough. That concept of adoption and what does adoption take gets back to all of these areas that we've been talking about, things like governance, ensuring that we really understand how decisions are being made, how the data is being used, what data is being used, who's involved in those processes. I find regularly, I sort of laugh at it. It's not funny, I'm sure, but it's like, oh, hey, we forgot to ask imaging. I'm like, fascinating, right? I mean, when we're talking about how we use these tools or in how we do a very large implementation that actually results in adoption, thinking about who our stakeholders are, really understanding their contribution and the workflow that happens as a result of agentic AI or an EHR or the implementation of any new system, getting back to this adoption mindset. I think we are finding more and more organizations do have that adoption mindset, really do understand the difference between implementing something and truly getting it to drive value within our organization. You spoke about something just in the last piece that we were talking about. There is now, AI, Gen AI coming into our environments, right? Whether we like it or not, whether it's Epic bringing it or a revenue cycle vendor bringing it, there are folks that are starting to push those tools our direction, and really understanding how we're also going to work with our partners around those processes is one of the other things that we're seeing as an important area for us to consider.
Thanks, Heather. I thought maybe we could mix things up here and maybe go into a survey slide that I wanted to share with the group here. So if you kind of dissect this a little bit, in a recent global survey on Gen AI conducted by NTT DATA, healthcare and life sciences executives expressed a fascinating disconnect, if you'll see up in the upper left-hand corner. 81% of organizations note having a well-defined Gen AI strategy in place. Yet only 80%, or rather only 40% of the healthcare C-suite agreed that the Gen AI strategy is strongly aligned to the business strategy. Now that's concerning. I'd be interested in both your perspectives on this. It sounds like there's a rush to strategy and yet a little bit of a lack of alignment to value. Dr. Cole, how do you sort of bridge this gap to ensure Gen AI investments can deliver true business value?
Yeah, I really think it requires a fundamental rethinking of how you look at your business model. And so I'll give you just a brief example of that because, I mentioned I designed our Oschner 65 Plus clinics. What these really are is just a completely reinvented business model for primary care, whereas the conventional business model of primary care is entirely volume driven. And the value of primary care is seen through the lens of it being an acute care feeder to your higher margin generating service lines, your procedural service lines, your surgical service lines, right? Like that's the value of primary care, right? In a full risk type of a model, the value of primary care becomes how well can you manage a population, how well you can reduce avoidable utilization, because now your business model is your medical expenses are not your fixed cost of your hospital. Your expenses are the medical expenditures themselves. So all those dollars that were previously revenue for your health system in a full risk model, they're expenses. And so the way to try to make the business case for that is you have to now reduce avoidable medical expenditures by keeping people healthy and out of the hospital. And so it's really sort of applying that lens of not thinking in the traditional economies of scale, generate as much volume as possible. It's thinking about it in terms of economies of scope. And economies of scope is now what I really want is I'm going to reduce avoidable utilization, which used to be my revenue. What I want to do now is I want to grow my customer base. And in order to grow my customer base, I need to look at things through the customer lens. And what do our customers want? Well, they want to stay as healthy as possible. They want to have as high quality of life as possible. They want to have as good of an experience of care as possible. And so how can we begin to look at that through a lens of growing our customer base, sort of like customer lifetime value as expressed through customer retention, loyalty, advocacy. And so then it becomes the lifetime value of that customer and what I can deliver to them and earn their loyalty over that process. So it's just thinking about it through a very different lens of new business models. Because if you look at it through the old lens of, every bypass surgery and COPD exacerbation is revenue, then you may not get there. So it's having to think about the value proposition very differently. And then what is the role of agentic AI in being able to help us to deliver that? And that means improving the experience of care for the patient, improving the experience of care for the provider, and delivering better, more effective care that reduces avoidable utilization.
Extremely well said. It makes sense. Heather, any thoughts on the same?
I think Dr. Cole covered it so well. I think the only kind of addition I would say is two quick things. One is where care is being delivered, which we've already talked about a little bit, and how care is being delivered, just to kind of double down on that, is changing so rapidly that I could see how these might misalign, right? Because we know that the way care is being delivered today and into the future is going to continue to change. And so the business strategy and the Gen AI strategy, are going to have to stay so tightly coupled that it doesn't surprise me sometimes that they are not. The other is I've seen in organizations that sometimes, especially in very large health systems, the strategy for one area isn't just well aligned with some of the business strategy. And sometimes there's even competing strategies, not intentionally, but of course, because some of them are, clinical goals and business goals and financial goals are difficult to align in healthcare. I mean, it's a very hard area, I think, to work in some ways from a profitability perspective, and the many kind of pressures on clinicians across the board, nurses, pharmacists, physicians, and others. Along with some of the business drivers that we're seeing, and is a lot of change still, and a lot of new technologies being introduced, which is creating additional pressures.
Yeah. Thank you. I want to make sure we allow a little time for questions. I have one more kind of fun question that I like to ask anytime I get exposure to, the SMEs like the both of you. I'm interested in just sort of thinking about, well, see, we've also got the, maybe we'll do this. I've got an idea here. So on the front end, I've got a question to ask both of you. I want you to think about, and then I'm going to launch into our poll just so we have something to kind of combine the time here. So the question to you both to ponder while we launch into the poll is, we talked about the here and now, right? We're still early. We need to kind of project it. I think there's so much potential into where we're going. And so where do the two of you see sort of agentic AI playing a role in the sort of the, healthcare system of the future? Where do you see in the most optimistic view on where we could make impact? I want you to think about that. And Heather, I'll be coming for you in a minute, but let me at the same time move over and say, folks want to do a bit of a poll for you. I have something to think about while we work through this. So of the following key building blocks for agentic AI adoption and deployment, which one is the biggest challenge for your organization? Right. So we've talked about several here as we've gone through. Is it AI governance? Is it kind of a lack of tool selection? Maybe you're indecision, analysis paralysis. Are you struggling with the business case for agentic AI solutions? Agentic AI developer resources. So is this really about having the right talent on the ground to execute? Is it access to data and content for agentic AI, or data and content quality? So just let that kind of marinate there for a minute. And Heather, I'll come back to you. So what are your thoughts on healthcare of the future, agentic AI? Where are we at?
And is the question where we can get to, not where we're at, right? But my view of like, aha, we've arrived, it's the future. Is that fair?
2 years, okay. 2 years, 3 years ahead. What are we looking at in the landscape?
Okay. As an optimistic person, I am going to say that we are doing less of this EHR, I would say paper shuffle, but it's not paper shuffle, data shuffle, and we have a lot more insights to walk into a patient room with, whether we're a nurse or a radiologist or a physician. so that as we walk in, we are prepared with the information to make a phenomenal interaction with a patient that's focused on the patient, what they bring, and having a conversation with them that also improves outcomes. And that's really hopeful, I know. But I do think that that companion, that kind of scribe, as we sometimes say today, that person that's coming along with us is Agentic AI. And they're really standing up our clinicians to be the best they can when they're in front of the patient and giving the patient their full attention.
Love it. I love the vision. Dr. Cole, over to you. Thoughts?
Yeah, I think it's worthwhile looking at it through the parable of upstream versus downstream, right? Where, it's a child is drowning in the water, and two friends are walking along. They rescue the child, and then before they know it, more children are coming, and so they're vigorously trying to rescue these children. And then one of the friends starts running upstream and the guy said, the other friend's like, dude, you're not gonna help me rescue these kids? And he's like, I'm going to figure out why they're ended up in the stream in the first place. And so, looking at it through that lens, I think a lot of what's happened in healthcare has been the overload of conditions that could have been managed earlier and better in a primary care setting that are not being managed. Like as a health system, one of the problems we have is, we'll have patients with chronic kidney disease 3 being referred to nephrology, and there aren't even enough nephrologists to manage chronic kidney disease stage 4. And so how do we get, primary care to the point where they can effectively manage chronic kidney disease 3 and prevent its progression to chronic kidney disease 4, so that we're not overwhelming the nephrologist, and we're, and we actually, and I think that's a good example, because we really are at a point where we can virtually almost eliminate end-stage kidney disease, not entirely, but dramatically, by virtue of certain new medications that have come out. The barriers are not the science. The barriers are reliably getting those medicines to the right people, some of the cost barriers, things like that. So it's really just looking at it through that upstream lens of, okay, how can we sort of bring all of this together in a way that lifts the cognitive burden off of clinicians, that automates whatever can be automated, that ensures those medications that are going to slow the progression of chronic kidney disease are done, and if they're not implemented, why are they not implemented? And being able to kind of just get through that. I think being able to probably touch patients in a way that improves engagement, that helps to foster that collaborative, trusting relationship with patients, restores that relationship, which I think has been lost when all you're doing is just moving from one room to the next as quickly as possible. And then I believe that in terms of leveraging it to generate a hard return on investment and a measurable impact, I think it's going to probably improve things like HCC documentation to allow for better risk-adjusted payments within Medicare Advantage contracts. I've already talked about how I believe it's going to improve clinical outcomes, which I think is going to reduce the burden on specialty care. I think reducing the amount of time that it takes to deliver excellent care in order to improve physician happiness or restore the joy of practice, making sure that specialists are seeing the patients that they need to see instead of the stuff that they don't. Because right now what specialists do is they'll hire a nurse practitioner and have them manage the stuff, because they just teach them how to do it. And then imagine how disappointing it is to a patient who goes to see a specialist and they end up seeing not the specialist, but a nurse practitioner. But it's a function of the specialist not being able to see all of those patients. And so, and then ultimately improving the patient experience and engaging them. I think all of those have the promise, and that's certainly how we're looking at it.
Loud and clear, Dr. Cole. So it's get to the head of the stream and bring life jackets, right?
Yeah.
All right. So I want to make sure to give the audience a voice, but I see we did have our results come in, and I got to be honest, I'm not surprised here, because if you really if you look at the center of gravity, the towers for data are really around governance and business case kind of understanding as the barriers to entry. And that all kind of rolls up to, education. And one of the things I think we have a lot of or is getting a lot of traction from my experience, is just getting in and doing, sort of agentic assessments, going in and understanding business processes, understanding where the candidates are for applied, generative AI capabilities, looking for automation opportunities. And that really helps to bolster the business case, understanding for where the art of the possible can take place. And then I think governance too is very important, which is really understanding the risk, understanding data readiness, all those sorts of things. Have we established a governance review board, a center of excellence around this? Do we want to invest in this area? So definitely not particularly surprised in how those come up. And so with that, as we 5 minutes remaining, Mariah, can I ask you to maybe step in and help sort of triage some of the questions that we've got on the back end?
Absolutely. Yeah, we've had a number of great questions coming into the audience, and everyone who's listening, now is your last chance to put your question in. So we'll get started with this one, and it says, would love to hear how providers are deploying Agentic AI. Is it typically voice activated or other?
Heather, do you want to take that one?
I actually don't know that I would say I have a good sense of voice activated versus other. I think the tools that I've seen, for example, Agentforce with Salesforce, not voice activated, but Dr. Cole may have some better insights on what they're doing in their implementations.
Yeah, so far, again, we're pretty early on with the agentic stuff. So that one has really been more patient facing. So the stuff we've done with the providers has really been in this more in the space of generative AI, and it's really going to be information synthesis. So the ambient listening, the chart summarization, the patient messaging, and that has not been, voice activated at this point in time. But I think it's rapidly evolving, and I'm sure we'll see more as time goes on. A year from now, or maybe even 6 months from now, that answer will be different.
I think we're seeing summarization of information the most, if that answers the question.
Perfect. Our next question asks, are more clients building their own agentic AI applications or consuming it through a vendor partner product?
I have a sense today in the provider space that there are more organizations working with their current partners, EHR and others, around these. But where we oftentimes come in to help them is around strategy, governance, bringing those pieces together that drive the value. And so I think it's a bit of a combination. I don't see a lot of organizations building out these as sort of one-offs, but I'm interested in what you're seeing, Raleigh and Dr. Cole.
Yeah, I would say it's very, to that point, Heather, a lot of consumption, right? A lot of consumption for incumbent platforms. And so, if you're an Azure shop, you're consuming and building agents, as part of the M360 suite, or within Agentforce, as you mentioned earlier, Heather. So it's like, that's the crawl, walk, run. It's like, look at what we have as our incumbent platform or data framework and start to kind of maybe experiment, on that side versus building kind of net new.
Nothing to add.
All right. So our next question asks, mobile healthcare meets the needs of the underserved, where they're at in order to eliminate the barriers like transportation. How would you see AI being used in this type of medical environment?
I'll take that first stab at it. I think again, it's part of re-envisioning the care delivery model, right? So, part of what's wrong with traditional healthcare, and there's a word that we apply to patients in traditional healthcare that I don't ever use anymore, and that's the word non-compliant. And so in traditional healthcare, the traditional framework has been the physician's job is the patient comes to the physician's office, the physician's job is to kind of advise them or tell them what to do, and then the patient's job is to do it. And if they no-show the appointment, or if they don't carry out the recommended intervention, they're called non-compliant. I think that is an outdated term which should be abandoned. And I think how we're going to look at it is how do we reinvent the care model, completely redesign it to where we're not counting on people to necessarily come to us. And there was, you look at some of the more innovative models out there where, they'll take people who are health coaches, and the health coaches essentially, they have to have two skills. One is empathy, and two is a set of shared life experiences with the people that they're going to coach. And then they are the ones who are interacting with, patients. And when they call, patients listen and building those relationships that way. I just think we have to rethink how we can build relationships with patients and doing it not necessarily without human capital of just, millions of health coaches, but rather where can Agentic AI play a role in that and meet patients where they are and not necessarily force them to come to us. And when we look at them failing to, adhere or carry through with a recommended intervention, it's not non-compliance. It's the question is, what are the barriers, obstacles, and struggles they face that have prevented them from being able to do that? And how can we shed light on that and then help them to overcome those barriers, obstacles, and challenges in order to help them make progress toward the goals that matter most to them. And so I think it's looking at it with a fresh lens and re-envisioning what's possible.
I might just even add to that just for a moment. From a technical perspective, if you think about in the concept of maybe an augmented care at home, right? And you think about that cartoon slide that I talked about at the beginning, there are times when you think about a care pathway where it makes sense to have a discussion with a body of knowledge. And then there are times where if you think about, being in tune with remote patient monitoring, it makes sense to maybe escalate the experience and create a reverse call or engagement with a nurse, et cetera. And so I think using the levers of technology within that scenario where they make sense along a care pathway could be pretty powerful.
Even that proactive reach to the community. We know there are people that don't come to see us who need us, right, in healthcare. So that proactive community outreach.
Amazing. Well, unfortunately, that's all the time we have for today. So thank you to Raleigh, Dr. Cole, and Dr. Haugen again for this amazing presentation and answering those questions. And also thank you to NTT DATA for sponsoring today's webinar. We hope you all have a wonderful rest of your day, and hopefully we'll see you soon.